There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, is it okay for someone to miss their high blood pressure medicine for a week? Answer by Jason Rennie. I don't know what medication you're on, but I doubt there is an effective dose in your system at the end of the week. I have hypertension myself, and I know on the occasions I have missed a few days. By day 3 I have a raging headache that most painkillers won't do much of anything to help with. You are basically asking, what happens if I have high blood pressure for a week again? I'm not a doctor, so please consult an actual physician for an answer, but here is some speculation. If you could avoid it, it would probably be a good idea, as high blood pressure does damage over time. I would also guess that if you have been treated for a while, then your system isn't used to it and something could be in danger of failing somewhere, but your current lower blood pressure doesn't put enough stress on it to cause it to fail. The sudden increase could be a serious problem there. Is this something you have no choice about, or something you're just idly wondering about? There is probably things you could do to make missing a week less dangerous if you couldn't avoid doing so, like doing other things to manage blood pressure, avoiding caffeine, things like that. They might mitigate the risk somewhat. Consult a physician if you need to do this for some reason. Answer by Robert Harvey. It's not too sensible to ask this sort of question of random idiots on the internet, who have no idea how bad your blood pressure is, nor yet why you have been prescribed it. No idea of your age, gender, diet, workload, medical history, body mass, or genetic history. Of the reason you skip doses, so the doctor who prescribed for you is the right person to ask. That said, I have had to skip mine when travel plans go awry, and I'm still alive. Which is a very small data point and no basis for making judgments. It is, in general, a bad idea to have fluctuations in therapeutic concentrations in the body. Answer by Dr. Joy Edwards. Some of the dangers of having elevated blood pressure are stroke and kidney failure. Depending on the severity of your hypertension, a week could be the difference between life and death, or it could be no big deal.